each other. If the nervous system controls all of these systems, well, then I want to know how chiropractic care can impact those systems. So I started to do blood work and I started to look at my patients more closely in that manner. I saw patients just coming in with more and more toxic challenges. The world has changed, and I felt, and my colleagues and people that I work with felt, no, our patients are metabolically challenged. And the more I learned about blood chemistry, I started to see that a lot of the reference ranges for what is considered normal was expanding wider and wider and wider. So we started to look for optimal ranges. We went to the same biochemists who come up with the numbers for the reference range and said, hey, what are the numbers for the healthiest among us? We would look at your blood chemistry and say, where is your physiology drifting? Let's bring it back. We're not going to wait for you to get prediabetes. We're going to recognize that there's a lot of canaries in the coal mine that everyone's ignoring that's pushing you towards an inflammatory state or a pre-diabetic state. We started to look at vertebral subluxations, structural, metabolic subluxations, biochemical. So the term metabolic subluxation, again, if we just look at what is a subluxation, it's a interference with nervous system function. Metabolic means that interference is biochemical. If there's a metabolic subluxation, interference with delivering that fuel, then it must look like something on blood work. We usually will adjust a metabolic subluxation by adjusting lifestyle, adjusting their nutrition, using nutritional supplements at times to make sure that we can move the needle fast enough to make a difference. It's amazing because people are now coming to us with diagnosed medical conditions, right? And these diagnosed medical conditions can be either acute or chronic. The chronic ones make up 80 to 90% of our country's medical bill, right? We're talking about diabetes, obesity, heart disease, stroke, cancer. These are chronic disorders that have just skyrocketed in the 20th century. And now what we're seeing in the 21st century is that people are just being diagnosed with those conditions at younger and younger ages. We look at blood work before, we look at blood work after. The changes my patients see are the kinds of changes that cardiologists wish they would get from their medications, and they don't even come close. Now, the only difference between what a cardiologist does and what we do in the sense of patient care is that the cardiologist says, keep doing what you're doing. Yeah, eat right and exercise. Take this medication. What we say is, we're going to get involved in your exercise, your sleep. We're going to get involved in your nutrition and your supplementation. But what it does is it engages the patient to take responsibility for themselves. Is there a cure for diabetes? The answer is no. And that's a truthful answer. I, the doctor, cannot cure you, the patient, of diabetes. But if we ask the question differently and we say, can I cure myself of diabetes? The answer is yes. Here's how you do it. Step 1, 2, 3, 4. So the patient does the work. The doctor doesn't do the work. The doctor does the analysis, provides the motivation and the guidance to cut through the BS and get right to the point. How can we adjust your metabolic subluxations that we see here in your blood chemistry as quickly as possible? And that's the art. That's the art of what we do. We adjust those subluxations. We bring their nutrition and their blood chemistry back into alignment so that their physiology can express itself the way it was meant to.